to Defense Art TV. I'm your host, Sifu Robert Brown. Today's show is about body targets and what happens when we strike them. It features Dr. Mike Savona, Hawaii's Doctor of the Year for 2003. So stay tuned for the effects of striking vital zones on Defense Art TV.
Aloha, my name is Sifu Douglas McLeod. We have our special guest, Dr. Savona. Thank you for coming.
You're very welcome, Doug. To an anatomist, every bone that meets another bone forms a joint, even if it's a joint that doesn't move. You know, our skull is made up of many bones, and we don't think of them as being joints because they don't move, except with the exception of perhaps our jaw. But these are the areas to strike. On the skull, they're along the surface. In the back of the skull, they form kind of like the Mercedes-Benz insignia, you know, that propeller, if you will, on the back. And of course, there's a lot of areas. I can go back to that slide in a few minutes and show you on that, where you can see vaguely the outlines of where they go. They're weak points. So they're points where if you strike a blow, the transmission, you know, of that force is going to create some problems. You know, it always amazes me when I watch the World Series that all these guys who get up to hit the baseball do something that no 7-year-old would do, and that is that they stand with their baseball bat with the indent of the Louisville Slugger facing the pitcher. Now, anybody who's played baseball as a kid knows you don't do that, because if the ball hits it, what happens to the bat? It breaks. Okay, and it breaks because it's a weak point. It's been stamped there, so the integrity of the surface is broken. Well, these guys don't have to pay $8 or $9 for a bat, as we all did when we were 7 years old, so they haven't learned to turn the bat the other way. But it's the same thing with this, where you have a joint meeting, it's a weak point. On the rib cage, you see the bones coming around, and right here you see this white. This white is cartilage, okay? And they actually form a joint. We call these joints the chondral, which stands for the joint between the rib, costal, which stands for the rib itself, the chondral stands for the cartilage, sternal joint. Okay, so if you're going to throw a blow at somebody to their chest, which do you think is a better place to hit? The center or over here?
Throw it in the rib.
That's right. Hit just off center. Okay, because if you hit off center, you are more likely to create a break or a crack or something that's going to be more painful. Okay, so if you hit in this area here, you're probably going to cause much more discomfort than if you hit straight on. Now, that's not to say this is another area here though that's very sensitive, and Sifu Dennis and I were talking about that too. A knuckle on the sternum, one of the most uncomfortable things you will ever feel. Okay, and I'm not talking so much as a blow. It can be a blow. But if you're grappling in and you put a knuckle against somebody's sternum like this, somebody's reaction to that is going to be to do this. They want to get you off of there, because that's very uncomfortable. Okay, so these would be the areas to go for. Now, if you break a rib, what happens? Can you cause some damage to the lungs and heart? Yes, but I will tell you this, it's more difficult from the front than the back, and that has to do with physiology. If you break a rib here, if you were to break that, what happens is that rib moves out, and that has to do with the fact that all of the muscles of the chest that attach to the rib, they're designed to pull the rib up and out. Our rib cage works like the handle on a bucket. You know how the handle swings up and out, and that's what happens. So if you create a break, what happens is it moves away from the tissue underneath it, except in the back. Okay. In the back, that doesn't happen. And if you create a break of a rib in the back in these areas here, you can actually puncture a lung and deflate it. Yes, Doug?
When you separate a rib, why is it so painful?
Well, because there's a lot of nerve tissue there that travels around those ribs, and there's a lot of muscle tissue and vascular tissue that's very sensitive, Doug. And that's why it hurts like the dickens. And that's why it's difficult to even move it. You know, the reason is that bone on the surface of the bone tissue is where all of the pain reception is. When you create a break, you now have rib that often overlaps a little bit and rubs against each other with every movement you make, because all the muscles, you know, that you use to do this, this attached to those ribs. And of course, every time anyone who has broken a rib knows, every time you take a breath, it catches you. And of course, if you break somebody's rib, what are they going to do? They want to protect that. They don't want to move. They want to fix their arm against it. And that creates a whole other area that you can use to your advantage if this is a fight for your life or whatever it is. It's also an area that's not hard to break, so you have to be careful with this with anything you do. Now, the back of the ribs are, if you break them, when we see people who are in automobile accidents or have trauma to their chest and actually have a lung go down, deflate, lungs are filled with air, oops, excuse me, and they will go down, if they're punctured. It's usually from a back or a penetrating injury, where the rib is driven in, but that usually requires more than one break in the same rib. But the back ribs are much thicker, so they are harder to break. Now, one of the things that, Doug, you had mentioned earlier is that things can happen later on, and they can. You can be involved in a fight or something and be struck a blow and then not feel anything. And then later on, some trivial event you do, picking up a bag of groceries, picking up your suitcase, will complete the break that was started before. And we see that a lot, where people say, God, I don't understand this. I was doing all this work before and nothing happened. Now I just pick up something and it happens. See, for Mike?
Now, the rib cage, when you break a rib, you couldn't set a split, like a broken arm. What do you that requires surgery to get into the break?
No, what usually happens...
You're going to push it out again, yeah? Wind it up?
Well, you can do that, but the problem with that is that, and in fact, this is what they often do. A lot of people, for example, if you watch the Rocky films and all, they put tape. They tape the ribs. And you can do that. The problem with it is it interferes with how deeply you can breathe. There's a higher risk for pneumonia. So usually, you leave them be, because what happens is that they tend to move out a little bit and overlap, and the body will heal that. They'll grow together. We call that knitting, but the bone will actually heal. And for years, you can see it on an X-ray as a bump. So you can see that for a long, long time.
So where it broke, it doesn't fuse there?
It won't fuse end to end. Rarely will it do that. Sometimes those types we call just cracked ribs. When a break occurs, usually you get this. Yeah.
And then so you eventually have it.
You will eventually heal it like this. You'll see a bump. It'll be thicker, and then with time it will remodel and smooth out. Maybe take 20 years, but eventually it'll get to a point where you couldn't notice it was broken.
And you say you get pneumonia.
That's right, because what happens is that if you wear a binder, if people put something around you to bind your chest, what happens is you don't expand your lungs as you should. The bottoms of them will become like an accordion, kind of scrunched, and that's an area where infection can develop, and that's a very common thing that occurs. That's why most of us.
You're pushing out the toxin. Is that it?
Yeah.
Filter.
The lungs clean themselves by when you breathe. There's a mechanism there, like a vacuum, that cleans them out. So if you're not breathing, you're in trouble. That's why people who lay around in bed too long can get pneumonia. Okay. Now, if you look down here, though, you'll see that as you go down from top to bottom, the cartilage gets bigger, or at least the area of cartilage gets bigger here. And these are the ribs that are more susceptible to fractures from blows, palm thrusts, this kind of thing. Aimed at this area will cause a lot more damage. And underneath these areas here, the diaphragms come down to about this level. Underneath these areas are two organs that are vascular, the liver on this side, the spleen on this side. And they can be a real problem if they're punctured.